Hello, everyone. Performance Health welcomes you to our webinar today. We'd like to thank L&R for partnering with us to talk about lymphedema compression products and advanced wound care solutions. If you have any questions, please enter them into the Q&A box, and we'll try to address some of them during our Q&A time at the end of this presentation. And with that, I'd like to hand it over to Lindsay.
Thank you, Morgan. Hello, everybody. Good afternoon. Thank you for joining us today. My name is Lindsay Ryback, and I'm the North American Marketing Manager at L&R USA. So we'll quick jump into who is L&R USA. We are a global manufacturer based in Germany and Austria with a rich history of over 160 years of manufacturing and supplying wound care and compression products. In 2014, L&R acquired a small family-owned company called Solaris, and that company was the creator of many great garments and wraps to be able to help patients better manage their lymphedema or chronic swelling. So in 2014, the Solaris collection joined the L&R product portfolio to be able to offer you a full comprehensive range of our bandaging, wound care, and Solaris collection, which we'll cover today. We're based in Milwaukee, Wisconsin, and there is our office there on the top right. So today we'll start with the multi-layer bandaging products that we have to offer, and then move into some of the really easy self-care garments and wraps between the TributeWrap, ReadyWrap, and ExoStrong. We'll then briefly touch on one of our key wound care products, Debrisoft, and then talk about the different programs that we have through Performance Health to support you. So here we've got the treatment of lymphedema. So many of you may already know the gold standard of treatment for lymphedema management is called CDT, complete decongestive therapy. And this comprises a list of these things here: a really light, gentle manual lymphatic drainage massage, compression bandages, making sure patients have proper skin and nail care, and of course, diet and exercise. And then one of the things that's really challenging with lymphedema is it is a lifelong condition. And so patients being able to bandage for the rest of their life is quite challenging. And so it's really important to have the self-care garments and wraps as well, so that they can be compliant and be able to manage this lifelong. So where L&R fits to be able to support you is with the compression bandaging and the self-care products. So we are really truly integrated into this complete decongestive therapy process. So the first piece that we'll go through is the multi-layer bandaging products. L&R has the most extensive range of multi-layer bandaging products, from sizes to widths to types of materials, to be able to support the patients and their needs. So starting with the skin protection, you can see 3 different options here, going into the finger and toe wrapping, the padding to help build up that cone shape for even distribution of pressure. Then you've got your foam, so that focal compression to help break up any fibrotic tissue. And then the most important key component, the short stretch bandaging. Then you'll secure that with tape at the end, and that's the process there. So we'll break down each of these steps and talk about the different multi-layer bandaging products within each of these steps. So within here, with the skin protection, we've got 3 different stockinettes to choose from. The TG tubular is going to be the most popular stockinette option available. It has a really high stretch to it, and it's very lightweight and breathable. If you can imagine, patients are going to have all of these layers of bandaging in place, and so it's really helpful for them to have a nice, thin, breathable layer. This one also comes in really large sizes, the largest sizes in the market. So if you have some of those really large thighs that you're working on bandaging, or maybe an abdomen, we do have a K1 and a K2 size, which is a great option within this TG tubular. If you've got a patient that has more skin integrity issues, more sensitivities, the TG cotton is a great choice. It is 100% unbleached cotton, so very skin friendly. And then lastly, within the stockinettes, we've got our TG Soft, which is going to be kind of like a terry cloth blanket or towel. It's going to be a little bit thicker. It's going to provide a little additional padding in addition to skin protection. And so that's going to help with some of those bony prominences. So you can see this leg, it's very thin, it's very fragile. It's going to need a little additional padding to make sure that that pressure of the bandage is not too intense on the limb. So you would put something on this for this type of elderly patient or perhaps a pediatric patient who may need additional padding in place. So that stockinette will absorb perspiration and oils, protect the skin. In TG-Soft's case, provide a little additional padding, and then that's your first step. The next step is wrapping the fingers and toes. If we used a more rigid, more robust bandage, it would be really challenging for the patients to be able to have that mobility in their fingers and in their toes. So with those patients, we want to bandage the fingers and toes with a lighter bandage, a gauze conforming bandage. These are typically unrolled, folded in half, and re-rolled to be able to get double containment as taught in many of the lymphedema training schools. Then there is a specific bandaging technique that you can do to then wrap those digits. This is going to allow some of that mobility of the hand, but making sure that you're getting rid of that swelling, that edema in the fingers and the toes. Even if the fingers and toes don't have that presentation of swelling, it's often important to still bandage the fingers and toes so that swelling doesn't migrate there. So jumping into step 3. So with lymphedema, you often see a lot of different presentations, and some of them have some irregular shapes and sizes that the patients are presenting in. And what you want to do is you want to make an even distribution of pressure when applying the final short stretch bandaging. So this is going to help build up that shaping to make it look like a normal cylinder shape, like a normal limb. And so you do want to build that up and pad in those specific areas. It will also help distribute that pressure to make sure that it's going to have that nice, smooth, even compression underneath. With that, we've got 2 different options. We've got Solona, which is our synthetic padding. It's kind of like a cloud. It's really fluffy. It's really soft. You're going to get a few uses out of it, and you'll simply roll that onto the limb to be able to get that padding in place. The Rosedal Soft, though, is great for patients that are going to be bandaging for a little bit longer of a period of time that want something less disposable. And it also is going to be good for helping break up any fibrotic tissue because it is a foam-based product. The Rosedal Soft has a little bit more longevity because it's actually machine wash, machine dry up to 50 times. So giving a really long life to that bandage for the patients who are using this in application. The next step is step 4, focal compression. This is an optional step, but many patients can benefit from this. This is our high medical grade compression grade foam, and this foam is really dense. And so when you're using it, you can either put it on as a roll, you can chop it up into little chip foam pieces, and you can put them underneath any sort of compression. That chip foam or that flat foam will press into the tissue, and it helps create this micro massage effect, which helps break up really tough fibrotic tissue or hardened skin. When there's that hardened skin in place, if you can imagine that lymph fluid's trying to move its way out and it's not able to get out, it's getting stuck in the process. And so it's really helpful as this foam breaking that up to allow that lymphatic fluid to flow more freely and to allow the compression bandages to work more effectively. We also have some different shapes which are really helpful to fill in some of the concavities. So for example, these little kidney shapes can be used around that ankle bone region when applying for the lower extremity, and that helps fill in a little bit of that gapping so that you don't get pocketed swelling. You can see this therapist down in Tennessee had utilized our Comprex here. It's a large sheet. They cut that out into a flower shape. They stuck that patient's foot through the hole. They pulled up the petals, and then they have finished the rest of their multi-layer bandaging process. And you can see here the great results that they were able to achieve by breaking up that fibrotic tissue. Of course, you may wonder what they did with the rest of this. What's great is you can use all that scrap on the end to be able to cut your own different types of shapes for other patients, or maybe use it to make some chip foam to be able to apply in other scenarios as well. We also have the Comprex 2, which is not a high medical grade density foam. It is actually a low density foam. But what's unique about this product is it's sewn in channels. So you can put that compression in place and be able to directionally focus where you want that lymph fluid to move. So these channels can be directed based on the lymphatic pathways. So your primary pathways going vertical, or you can put it at a diagonal in that chevron style. That's going to be able to direct it to the collateral pathways because you know there's damage and you're trying to reroute that. So a lot of therapists will use this under bandages, under garments and wraps, but it also is great to be used under a compression bra for someone who has lymphedema in the breast area, as well as in the genitals under biker shorts. So sometimes it can be a little time consuming to cut the compress and put that in place. And so we have the swell spots, which came over from the Solaris collection portfolio. And this is a full range of off-the-shelf edema and fibrosis pads. These are all machine wash, machine dry, and it's going to have a 6-month warranty. You can see here there's a lot of different styles to choose from, and you can use them in whatever direction, whatever place that you would like on the body based on that patient's needs. You can see here, this is one of our most popular ones. It is our swell spot breast pad. This is great to be used under a compression bra or to be bandaged over top of it, but it has all of these little chip foam pieces in each of these pads nestling into the tissue, stimulating that lymphatic system and breaking up that fibrotic tissue to allow for better lymph flow. You can see here that it's used for the breast, but you could put that on its side and use it around the thigh. So there's a lot of versatility to each of these. You can see we've got circular pads, we've got masks for anything in the face region. You can see we've got some genital pads here. We've got some lobule lifters here. You can put that underneath that lobule to give it a little lift. So lots of different utilities for each of these. And definitely happy to, on a separate occasion, be able to go through and be able to provide more details on each of these different pads and what kind of usage they each have, because there is a lot to go through. So then the most important piece is the short stretch bandaging at the end. This is going to be that high working, low resting pressure. So your ACE bandage or long stretch bandage has a very high stretch to it. So if you can imagine, it kind of stretches to infinity. So when that patient goes to rest at night and they're really swelling quite a bit with their lymphedema, once they go to rest, it recoils back on the limb and can cause some irritation, some discomfort, and sometimes can even dig into the tissue more than it should because of that really big rebound back onto the limb. What's great about the short stretch is it's going to have a very low containment to it. It's going to stretch just a little bit just to allow, for example, that calf muscle movement, but it's going to have a really small recoil back because it only stretches a small amount. So it's going to be much more comfortable and safe for the patients to wear even at night. So this is something that's being worn both day and night, especially in that acute phase of therapy. Of course, the most important thing is to secure it in place. These patients are often wearing it for up to 2 days. And so you want to make sure that it's not falling down so that those patients are going to make sure that they're going to keep that therapy going when they go back home before they come in for their next visit. So of course, if you go through that acute care of bandaging and you go through that complete decongestive therapy process, this is oftentimes what a lot of these patients may look like at the beginning, but we want to decrease the swelling. We want to get that lymph fluid out of the congested areas. We want to break up any of that fibrotic hardened tissue. And we want to overall just improve their quality of life, that functional status. This limb would be a lot to carry around for that patient. And so where we can decongest that, we can really help improve their quality of life. So here are the types of results, like that leg before. You can see this was just one of the legs, but we have both of them here where you can see what type of reduction was achieved after that bandaging process. So we don't want to lose the progress. Once the patients get to this point, we want to move them into that long-term self-care. And so it's really important that we don't lose all the great progress we did here. And sometimes bandaging isn't possible to do for the rest of your life. A lot of these patients need something that's quick, something that's easy, that allows them to be compliant and to be able to fit into their lifestyle. So that's where the Solaris collection comes in. And this is where we're going to focus on our ReadyWrap, TributeWrap, and ExoStrong to be able to talk about how these products can really be great for self-care to be able to help them long-term. So to begin, we'll start with the TributeWrap. This is our off-the-shelf product for the evening nighttime, as well as low activity. We also see a lot of patients who maybe are wheelchair bound or bed bound that aren't in those high activity modes that can wear this even during the day because they don't maybe need something as strong as a daytime garment. It's very soft, very comfortable, so often a great selection for them. What's great about this product is it's really easy to put on. Each of the straps that are on the garment have a little hole on it that you can get a little pull on it and to be able to secure it in place. And you can do that all the way up the garment. This is going to help get that nice right fit and contour around the shape of the limb, even though it's an off-the-shelf style. It also is powered by CoolCore. So this is a chemical-free, innovative cooling technology that's built into the fibers that will last the full 6-month life of this product. It's going to help wick away that sweat and moisture and keep them cool and comfortable so that they can be compliant. Just like the swell spots, this is filled with a chip foam technology. So that chip foam is in the evening, in the night, or while they're resting in this product. It's nestling into that tissue, it's breaking up that fibrotic tissue and allowing for better lymph flow and helping overall improve that skin health. So you can see after a night of wearing it, this is what that limb will look like. Of course, this will go away in about up to 45 minutes at most, but you will see those impressions. So it's always helpful to let your patients know to expect that so that they don't freak out when they see that in the morning. That means that foam's nestling in, that means it's effective, that means it's working and it's the right fit. So this is a good sign to see, but it will go away. So just helpful to always give them a heads up. With the Velcro adjustability, we do want to make sure that this does not get popped open or get filled with cat hair or lint or things like that. So it does come with a complimentary sleep sleeve for over top of it to make sure that those straps don't get tangled in the sheet or lose some of its hold based on filling it with lint and things like that. So always put on that sleep sleeve on over top. The lower extremity style for the below the knee does have non-skid pads in place. So if someone's maybe going to bed, but they want to get up in the middle of the night to go get a glass of water or maybe to use the bathroom, they will have those non-skid pads in place so that they're not going to slip. The TributeWrap does come in a variety of styles, not just that lower extremity. You can see here we've got the below the knee and a knee to thigh, and these could be used in conjunction with one another for that full leg coverage. We also have one that covers the knuckles up to the axilla. And then we have a wrist to axilla here, which can be used in conjunction with the glove to get that full coverage. And that way, if maybe they're going to the bathroom, they can quickly just take off that glove and then put just the glove back on without having to put the whole application back together to be able to wash their hands. And then most recently, we did launch a garment within the TributeWrap range for the head and neck. So you can see here, we've got a head and neck unit up here, and we have another one down here. The only difference is this one has a little slit in the neck. So if they have a tracheotomy to be able to accommodate, that we would have that option available so that they would not need to go into a custom. They would be able to access that with a off-the-shelf product. So here's some real life patient application. You can see how easy it is for the patient to get a hold of that finger grip here to put it on. You can see the full adjustability up the whole limb. And you can see with this MCP to axilla how comfortably the thumb fits in. And here you can see that lower extremity combining those two styles together, the below the knee to thigh, and getting that full leg coverage. And here you can see a little bit of a close-up of what that leg looks like once you take that garment off. And you can see that great results nestling into the tissue of the foam. This is some of my most favorite results that I've seen in a long time. This patient used the TributeWrap head and neck, and you can see he can barely open up his eyes. He's got a lot of fluid buildup in his face. You can see here down in the same one down here, and you can just see how full that is. After wearing the TributeWrap for just a couple weeks, you can see the great results he was able to achieve. You can see more definition in his face. You can see that fluid reduction, and you can also see how much more he can open up his eyes where he really struggled before. So some really effective results in a very quick period of time. What's great about the TributeWrap is it is off the shelf and it's fully adjustable. And so a lot of these patients who maybe don't have as much time within their therapy, and they maybe need to leave therapy after only a few sessions due to what is possible with their coverage. What's great is that these garments can really help with further reduction as well. So it's not just for after they've fully reduced. Sometimes you need to, they need to get out of therapy sooner than they had planned. And so it's great to have these adjustable solutions that are going to help keep them progressing and losing that fluid reduction. The next piece is the ReadyWrap. This is our most versatile product within our portfolio. This can be used daytime or nighttime during high or low activity. It mimics very closely to short stretch bandaging with its low stretch, as well as its 50% overlap like the application of bandages. A lot of the patients that are using these are not just during that self-care phase. A lot of times these are beginning to be used actually during that acute care phase because it can be applied by a caregiver in a home health setting. It's really simple, really easy to put on, and it's sometimes much simpler than applying that bandage. And so this is going to be something that could be used in place of bandaging in some scenarios for certain patients because it's so simple, so easy to use. It does come in a variety of styles like the other products that we've shown. You can see here we've got a toe piece, we've got 3 different foot options, we've got calf piece, knee piece, thigh piece. All of these can be used in conjunction with one another to get that full leg coverage. And what's great is if they're a size medium in the calf, but maybe a size double extra large up in the thigh region, they're able to combine different sizes, different styles together to get that right custom-like fit in something that's off the shelf. We also have 2 different options here for the upper extremity. We've got an arm sleeve as well as a gauntlet, and these can be used together as well to get that arm coverage so that you can get that fluid reduction from the dorsum of the hand all the way up the rest of the limb. Something to point out here, these are some of our newer foot options. This one is our foot CT, and this product is very highly conformable and has a great contour to the shape of the foot. You've got those little grippers like you saw with the TributeWrap, those little finger grips to be able to apply, especially when you're having a hard time, those patients bending down, touching their toes, they can get a little pull on that to apply it correctly. And then it has adjustability around that ankle bone area to be able to get that contour, that right coverage and containment. We also have here the Foot SL. This one fits great into a shoe. You can see there's no adjustability on the top of the foot. You're going to simply slide that on and it's going to get that nice coverage on the top with the low stretch material, but it's going to have a little bit more of a thin presentation so they can wear normal footwear. You can see here, just like the foot CT, it does have that ankle adjustment here as well, so that you can be able to get that contour though around that shape, which sometimes is a little bit unique in terms of the shaping around the ankle. And then the most common piece that's used is this adjustable wrap for the calf. This is great for lymphedema, but also really great for your venous leg ulcer patients or general chronic swelling, chronic edema. The calf piece comes with a calf that comes with a liner, or you can get the fusion kit, which does come with a compression liner. So this one's going to have compression in the foot and ankle, and then it'll be combined with the calf piece. There's no compression in the liner that's up the rest of the leg, but you're going to get that in the foot, and then the calf piece itself will provide that compression the rest of the way up. So here, let's look at the calf piece a little bit more in detail. So this is the product, how it looks like when you open it up. It has really easy color-coded strapping system. So you're going to go white, light blue, dark blue, white, light blue, and if you had a tall length, you'd have an additional dark blue strap up here. So then you can easily instruct your patients, caregivers, or the home health nurse to be able to apply this really simply. You simply match up the colors and work your way up the garment. You can see here there is an overlap that's built in. That's a built-in 50% overlap that's stitched together. So you can make sure that you're going to get no gapping when you're applying this. It's going to have a very smooth, even coverage, and it's going to be very safe and skin-friendly for the patient. Because of the way that it's sewn, it also has the stitching in the back, and you can see that little block spine. There's nothing hard, it's just the way that it's stitched, but that's going to help keep that garment supported when the patient's wearing it, which is really important because sometimes wraps can start to fall, start to sag during the day, and it's not giving the proper compression that's needed. That spine here is just going to help it keep supported so it's not going to fall down, so those patients don't have to readjust it all throughout the day. So here's a patient using a different style wrap. This is an interlacing strap, which maybe you've seen this style wrap before. Without that 50% overlap, you can see here there's gapping because the patients didn't apply it correctly. And you can see some of those folds in the garment, which is where it wasn't giving proper compression. This wound was then later formed because that application wasn't correct, causing more skin and damage to the tissue. In that same study with the Journal of Wound Care, the patients applied the ReadyWrap. You can see it's quite a messy application process that this patient did, but because of the way that that stitches in the back, we were able to still get full coverage, and the patient was able to see great results. There was no damage done to the skin, and over time, they learned how to apply it correctly. But even when they apply the ReadyWrap wrong, it's still going to have a safe, simple application. And so there's no concern from that perspective, making it a really effective option for the patients to be able to use on their own or with a caregiver. Here you can see an example of a patient who was misdiagnosed, underdiagnosed for over 12 years. They finally got in contact with a lymphedema therapist, and you can see how much progression that skin had seen, how much fluid filled up in each of the limbs. And this patient, after a few weeks of putting that multi-layer bandaging process with the complete decongestive therapy with their therapist, they were able to see great reduction, several liters of lymph fluid out of the limb in just 1 month. This patient then wanted to go on vacation. They still had more reduction that they needed, but what they were able to do is send that patient on his vacation with the ReadyWraps. And so they were able to maintain the progress that they had made. And by the time he came back, they had not lost any progress and they were able to pick back up where they left off. So this is a great way to show how patients can really be able to manage their lymphedema and have that independence, and how this can really fit into their lifestyle. So then the last piece we're going to talk about is flat knit. So I always like to show circular knit versus flat knit. Most people are very familiar with circular knit, your general compression stockings that are out there. But with lymphedema, some of the presentations are a little unique, and you can see here it can dig sometimes into that skin fold. While these products may be both 20 to 30 millimeters mercury compression, the containment that's received from a flat knit, a much denser material, is going to lay much flatter on the limb, where a circular knit is much thinner, and it's going to sometimes migrate into those skin folds, almost causing this rubber band looking effect like you can see in the limb here. This one here, you can see it lays much flatter, much smoother, even though the presentation is much more unique. So flat knit is going to be the gold standard of treatment for lymphedema because of the way that it lays on the skin and the way that it's a little bit denser, mimicking more of your short stretch bandaging versus a long stretch bandaging, which that long stretch is more like the circular knit. So L&R has a unique range with the ExoStrong. We are the only company in the market that offers a full line of arm and leg styles for flat knit that's off the shelf, which is about a 60% cost savings compared to custom made. These are fully off the shelf, good for day, good for night. And it comes in a wide variety of styles. You can see here we've got a wrist to axilla arm sleeve that can be paired with different glove or gauntlet options. You may see here 3 different gloves. You got the first one, that's a quarter finger. This is a half finger, and this is a full finger. So all different customization that you can get with seamless gloves that's fully off the shelf. We also have a below the knee as well as a full thigh high that you can select from with a wide range of styles as well as lengths. The gloves are probably the most commonly used because gloves are the most expensive part of the application for flat knit. And so to have a glove that's going to be fully seamless, super comfortable, but going to be fully off the shelf is really key for that application. So then the last piece that we'll speak on is wound care. So that's with our Debrisoft product. This product is great for cleansing a wound to make sure it's prepared for being able to heal, but it's also really great within lymphedema for removing that hyperkeratotic skin. So oftentimes that needs to be picked and pulled off, and this Debrisoft pad is going to be a really simple, skin-friendly pad. Patients have no pain when they're using this. It looks really soft and friendly, but it is very aggressive in terms of what it's able to do at a pain-free point. This all has little beveled edges at each of the edges of it. And it's going to then, once you hydrate that pad, you're going to move it in a circular motion, and you're going to keep doing that. If it's for a wound, maybe 3 to 5 minutes. For hyperkeratotic skin, it could be maybe 10 to 15 minutes in that circular motion, but you can see the great results removing that hyperkeratotic skin from the tissue and what kind of results that leaves afterwards. So that's the kind of before and after you can see after just one usage of one of these pads. This is not a reusable pad. You will discard that. You'll throw that away after that one use. And keep in mind, always hydrate. Most of the time when people aren't seeing the results, it's because they didn't really hydrate that pad with water or a saline solution. So with that, that wraps up the product portfolio that we're going to go through today. And I'll hand it over to Performance Health to wrap it up, to talk about the tools that we have to support you.
So Lindsay, thank you so much for that presentation. This is Trisha Hiley with Performance Health. I'm a National Accounts Manager, and so we want to thank L&R for the partnership here. And we're happy to expand on the education that was provided today to set you up with a one-on-one in-service. Your Performance Health rep will partner with one of our L&R partners. We can provide samples through L&R, and also they have a wonderful set of educational brochures for your patients. So if you're interested in learning more, please get in touch with us through our main customer service number at 800-323-5547. And you can ask for me if you call customer service, and I can also connect you with your local rep. So thank you so much for attending our program. Thank you, Lindsay, and thank you, Lohman Rauscher. Morgan, do you have anything to add?
It looks like we have a little time left for questions. So just as a reminder, if you have any questions, please put them in the Q&A box. Lindsay, it looks like we have one question. Do the ReadyWrap upper extremity pieces come with a liner?
The ReadyWrap upper extremity pieces, and I can flip back to that slide. 1 second here. They do not come with a liner. So the ones that will not come with a liner is first the toe piece, because it does have those individual digits, but then also these two pieces here. The glove can be worn right against the skin. And then the arm sleeve, we do have a liner, but it's actually built into the garment. So it's actually going to help with self-application as well. So once you open up those straps, there's actually a liner there, and that liner has padding at the wrist as well as at the elbow to be able to fill in those bony prominences and protect the skin. And then that will hold the product in place so that you can begin applying that wrapping structure over top of it. But it does have a liner. It's just built in here. And then, like I mentioned, no liner here for the gauntlet, but that can be worn right against the skin.
It looks like that's all the questions that we have today. Thank you so much for joining us.